So if you're standing in the kitchen and you suddenly smell like garlic and onions hitting a really hot pan, your mouth instantly starts watering.
Right. Oh, yeah, immediately.
Yeah, and you didn't, consciously tell your salivary glands to turn on. It's just this totally automatic input-output loop.
Right. It's completely involuntary.
Exactly. But imagine if right as your mouth started watering, you suddenly remembered this, like, incredibly awkward email you sent your boss earlier that day.
Ooh, the worst feeling.
Right. And imagine if just from that single thought, your mouth instantly went completely uncomfortably dry in a matter of seconds.
Just a total shutdown of the system.
Yeah, and it sounds kind of absurd when we talk about it in terms of digestion.
Right.
But when we look at human intimacy and specifically the biology of arousal and lubrication, that is exactly what happens.
It really is.
Like a single fleeting worried thought can act like a physical circuit breaker,
Yeah.
just completely shutting down this super complex biological process that was already in motion.
It completely overrides the system. We tend to view sexual arousal as this steady progression, like a train leaving a station, right? It just slowly builds.
Right, like once it starts, it's just going.
Exactly. But the medical data paints a very, very different picture. The nervous system actually treats intimacy not as a given, but as this ongoing negotiation with your environment.
Constantly checking in.
Yes. If the brain detects even a tiny hint of a threat, it halts the train immediately.
Which is incredibly frustrating for anyone experiencing it. And that's exactly why we're doing today's deep dive. We were digging into this fascinating stack of research for you today.
Really incredible stuff in here.
Yeah, we've got clinical protocols from Boston University's sexual medicine department. We have therapeutic guidelines from the NHS, and like several psychosexual studies.
A really comprehensive look at the issue.
For sure. We're looking specifically at how performance anxiety or, a history of painful intimacy actually physically suppresses the signals your body needs for arousal and
Yeah.
lubrication. And I think the biggest takeaway from all these sources and our real mission for you today is proving that this sudden shutdown is not a malfunction.
Far from it, actually. When the body stops responding during intimacy, it is a highly evolved nervous system doing exactly what it was designed to do.
Right. It's a feature, not a bug.
Exactly. It's just, executing a survival protocol in the wrong environment. And understanding the actual mechanics behind this is so crucial because it completely removes the shame associated with sexual dysfunction.
Which is huge.
It's massive. It proves it's not a lack of desire, and it's certainly not a failure on your part.
Yeah, and to really understand how anxiety breaks the machinery, we first need to look under the hood at how this machinery operates when there is zero anxiety.
The ideal conditions.
Right, and all the sources point straight to the parasympathetic nervous system.
The PNS, yeah. So this is the branch of your autonomic nervous system that's responsible for all the rest and digest functions.
Okay.
And every physiological study in our stack emphasizes this one, like absolute non-negotiable rule.
Which is?
Sexual arousal is entirely dependent on the PNS being at the helm. It just requires a baseline state of biological safety.
So you basically have to be in chill-out mode for anything to work.
Exactly.
So what is actually happening at the cellular level when the PNS is running the show, like when you're totally relaxed?
Well, when you experience sexual stimulation in that really relaxed state, the autonomic nerve endings in the genital tissue begin firing off these very specific neurotransmitters.
Okay, chemical messengers.
Right. And the most critical ones here are vasoactive intestinal polypeptide and nitric oxide.
Okay, wait, vasoactive intestinal polypeptide. That sounds like, the word intestinal is in there. That sounds like digestion, not intimacy.
I know, it does. It was originally discovered in the gut, which is where the name obviously comes from.
Ah, okay.
But we now know it plays a massive role in the pelvic region, too. VIP and nitric oxide are both potent vasodilators.
Meaning they dilate blood vessels.
Right. They communicate directly with the smooth muscles that wrap around your blood vessels down there, and they basically tell those muscles to just slacken, relax.
Which opens up the floodgates for blood flow.
Essentially, yes. The vessels widen, allowing this massive surge of blood into the pelvic area. And this creates a localized, like a traffic jam of blood, known clinically as vasocongestion.
And this is the part of the Boston University research that completely blew my mind.
Oh, the hydraulic mechanism.
Yes, because when people think of vaginal lubrication, I think they generally assume there are glands down there just like secreting fluid, like how sweat glands work.
Right, like a tap turning on.
Exactly. But it's not that at all. It is actually a hydraulic process driven by this blood flow.
It is entirely pressure-driven, which is fascinating. So as that vasocongestion builds up, the blood pressure in those localized capillary beds spikes dramatically.
Okay.
And that pressure actually forces blood plasma, which is this thin, clear fluid called transudate. It forces it to seep outward right through the solid walls of the vaginal epithelium cells.
Okay, wait, let me make sure I'm getting this right. The lubrication is literally filtered blood plasma being pushed physically through the cell walls just because the blood pressure is so high.
That is the literal mechanism, yeah. It's incredible.
That is wild.
Because in a normal, unaroused state, those epithelium cells are constantly reabsorbing sodium. And that pulls moisture back in, keeping the tissue relatively dry.
Okay, so it's usually pulling inward.
Right. But when the PNS triggers that massive rush of blood, the sudden spike in hydrostatic pressure completely overwhelms the cell's sodium reabsorption pumps. The pressure is just too high.
Okay, I was trying to picture this earlier when reading the sources, and it's kind of like a municipal water system.
Okay, yeah.
Like if a city suddenly diverts 1 million gallons of water into a single small neighborhood grid, the pipes don't necessarily burst, but the pressure gets so intensely high that the water just starts sweating out through the microscopic pores in the metal.
That's a great analogy.
Like the system hits its absolute physical limit, and the fluid literally has nowhere else to go but out.
Exactly. The fluid just pushes through the tissue, and it coalesces on the surface to create anywhere from, 3 to 5 milliliters of lubrication.
Wow.
And there's actually a secondary biological function here that is quite elegant. This transuded fluid, because it's blood plasma, actually shifts the vaginal pH.
Oh, really?
Yeah, it moves it from a highly acidic environment, which typically wards off infection, it's protective, to a much more neutral state that actually allows sperm to survive.
That is just a phenomenal piece of biological engineering.
It really is.
I mean, fluid dynamics, pressure thresholds, chemical messengers, all of it working in perfect synchrony.
When it works, it's a masterpiece.
But, and here's the big catch for the listener, this entire hydraulic event requires 100% psychological safety.
Absolutely.
Which brings us to the villain of our story today, the sympathetic nervous system.
Right, the SNS. This is your body's fight-or-flight system. And biologically speaking, the PNS and the SNS cannot operate simultaneously.
They just can't.
No, they function exactly like a toggle switch. One is on, the other is off.
Meaning, like we said earlier, you cannot be actively digesting your lunch while you are running from a bear.
Or, in this context, you cannot be physiologically aroused while your brain is monitoring for threats.
That makes total sense.
Right. If you are being intimate and a stray thought enters your mind, maybe you're worried about taking too long, or you start stressing about an unpaid bill, or even just fearing that penetration might hurt, your amygdala registers that anxiety.
And the amygdala is the threat detector.
Exactly. And it immediately flips the toggle switch. The PNS turns off, the SNS turns on.
I want to focus specifically on performance anxiety here, because the psychosexual sources talk heavily about a phenomenon called the spectator role.
Yes, very common.
Let's say you're in the moment, right? And you suddenly realize, I'm not really lubricated yet.
Right.
So you tell yourself to relax, but you are actively monitoring your own body to see if it's working. You're spectating yourself.
And the tragic thing is, the act of monitoring your own physical response is in itself a form of threat detection.
Wow. Just checking in is a threat.
Yeah. When you step outside of the sensory experience to basically grade your own performance, you are signaling to your brain that there is a problem that requires cognitive oversight.
It feels akin to like a computer suddenly freezing up when you're trying to run too many programs.
Well, I wouldn't even call it a freeze. The computer's actually running perfectly. It has just forcefully closed your web browser so it can allocate all of its processing power to an urgent antivirus scan.
Oh, that's a good way to put it.
Your brain drops cortisol and adrenaline into your bloodstream. Survival mode is activated.
And from a strict survival standpoint, sexual arousal is completely useless.
It's actually a liability.
Right.
Your body immediately restricts the blood vessels in the pelvic floor, and it redirects all that blood flow to your major muscle groups, your heart and your lungs.
Because you need your quads and your lungs to escape the perceived danger.
Exactly. And the moment that happens, the production of vasoactive intestinal polypeptide and nitric oxide just instantly halts.
So the chemical messengers are gone.
Gone. And without those vasodilators, the smooth muscles constrict again, the vasocongestion vanishes.
The traffic jam clears out.
Right. And without that intense hydrostatic pressure, The blood plasma stops seeping through the cell walls, and the lubrication simply stops.
All because you checked in on yourself to see if you were relaxed yet.
Yeah.
The tragic irony here is just staggering to me. Like, the harder you try to force your body to relax and produce this hydraulic response, the tighter the fight-or-flight system grips the controls.
Because the effort itself is the threat. The strain of trying is what keeps the SNS activated.
That is so wild. And while this totally explains, an isolated incident of performance anxiety, the psychosexual research in our stack focuses really heavily on what happens when this biological shutdown becomes a chronic, repeated cycle.
Yes, and that's where we get into some really difficult territory for a lot of people.
Right. We're talking about the transition from just a fleeting worry to a deeply ingrained history of painful intimacy. The clinical terms the sources use here are dyspareunia and vaginismus.
Right. So dyspareunia is the clinical classification for painful intercourse.
Okay.
And vaginismus is the involuntary spasming or clenching of the pelvic floor muscles.
So they just lock up.
Exactly. And these two conditions are deeply intertwined with the SNS toggle switch we've been discussing.
Because the underlying mechanism seems to be the brain's incredible capacity to remember physical pain. Like, it's just an evolutionary safeguard, right?
That's exactly it. The nervous system is basically a prediction machine. So let's look at how the cycle actually starts.
Okay.
Suppose someone attempts penetration when their body hasn't achieved that critical vasocongestion. Maybe they're stressed from work, or they're rushing, or even experiencing a postpartum drop in estrogen.
Sure.
Because the hydrostatic pressure hasn't created the transudate yet, there is no lubrication.
So you have severe friction, which hurts.
It hurts a lot. It causes micro tears and significant pain. And the brain logs that specific context.
Like the bedroom, the partner.
Yes, the environment, the act of intimacy itself, it logs all of that as a source of physical injury.
Okay, so the next time this person is in a romantic situation, the brain accesses that log. It doesn't even wait to see if it will hurt this time. It preemptively acts.
It treats the situation exactly like a modern car's collision avoidance system.
Oh,
If the car senses an impending crash, it doesn't ask for your permission, right? It automatically engages the anti-lock brakes, and it pre-tightens the seatbelts.
before you even hit anything.
Right. And the brain does the exact same thing in the bedroom. It triggers the sympathetic nervous system, slams the pelvic floor muscle shut, which is the vaginismus, and restricts blood flow to prevent arousal.
It is literally bracing for impact.
Exactly.
But the terrible part is, because the brain has clamped down on the pelvic floor and shut off the lubrication, the subsequent attempt at penetration is infinitely more painful than the first time.
Which then serves as fresh data for the nervous system. The brain says, see, I was right to be terrified. The threat is escalating.
Oh, man.
And this locks the person into a devastating, self-perpetuating loop. The fear of pain causes the physical dryness and the muscle spasms,
Which directly causes more severe pain.
which amplifies the fear for the very next encounter. It just feeds itself.
The psychological toll of this loop has got to be so heavy. Because if you don't understand the underlying neurobiology, like the transudate and the toggle switch,
Yeah.
it is so easy to internalize this physical response.
Oh, absolutely.
The sources highlight how often patients report feeling like, they are just broken, or they mistakenly believe they have fallen out of love with their partner.
They view their body's shutdown as a mutiny, like their body is betraying them.
Right.
But in reality, their nervous system is functioning with flawless efficiency. It has simply misidentified a safe partner as a physical threat based on past data. And it is doing everything in its biological power to protect the host from injury.
That reframing is so powerful for you as the listener. It completely shifts the narrative from, what is wrong with me, to, oh, my body is just trying to protect me, but it's overreacting.
Exactly. It's a protector that's just a little too aggressive.
So how do the therapeutic guidelines suggest we actually recalibrate this overreactive system? I mean, we have this hardwired collision avoidance system going off in the driveway every day. How do we turn it off?
Well, the clinical protocols all point to neuroplasticity. Because this pain fear loop is a conditioned response, it can actually be unconditioned.
Okay, that's helpful.
And cognitive behavioral therapy, or CBT, is frequently cited in the NHS guidelines as a frontline treatment for this.
I have to admit, I am always a little skeptical when I hear talk therapy prescribed for what sounds like a purely physical hydraulic mechanism.
Yeah.
Like, how does sitting in a chair and talking to a therapist alter the fluid dynamics of the pelvic floor?
It's a completely fair question, but it goes back to the brain acting as a prediction machine. CBT specifically targets what psychologists call negative expectancy.
Negative expectancy.
Right. When someone is trapped in that pain loop, their internal monologue isn't just, oh, this might hurt. It is a concrete, unquestionable belief. This will hurt.
They have accepted the pain as a guaranteed future fact.
Exactly. And that absolute certainty is what fuels the amygdala. It's what keeps the alarm blaring. So CBT systematically dismantles that certainty.
How does it do that?
It forces the patient to look at the thought, this is going to hurt, and cognitively reclassify it as merely a prediction. It's just a hypothesis based on old data, not a fact about the present.
So you are basically introducing doubt into the brain's threat assessment.
Precisely. By creating cognitive doubt, you physically downregulate the amygdala's alarm bells. You aren't necessarily forcing the body to relax. You are just lowering the volume of the sympathetic nervous system enough that the parasympathetic nervous system has a tiny window to boot up.
That's fascinating, just lowering the volume. The sources also place a massive emphasis on mindfulness and somatic therapy, which honestly makes a lot of sense when we look back at the spectator role.
Oh, for sure.
Because if observing yourself kills the arousal, then mindfulness is basically the antidote to observation.
Mindfulness starves the SNS of its fuel, which is future-oriented anxiety.
Right, worrying about what's going to happen in 5 minutes.
Exactly. So when you practice somatic grounding during intimacy, you deliberately pull your cognitive focus away from the outcome. You stop evaluating the lubrication or the muscle tension.
You stop asking, are we there yet?
Yes. Instead, you anchor your brain in neutral, present tense physical sensations.
Like what?
Like the texture of the sheets against your leg, or the temperature of the room, the rhythm of your own breathing.
Just totally mundane details.
Right. Because by flooding the brain with safe, neutral sensory data, you signal to the nervous system that there is no immediate predator in the room. The bear is not here.
Right. Now, I noticed a very specific behavioral intervention in the psychosexual clinic protocols that seemed almost counterintuitive at first glance.
Which was
They frequently prescribe a period of desensitization where penetrative sex is strictly forbidden, like entirely banned by the therapy.
Yes, taking penetration completely off the table. It is actually one of the most effective interventions available.
See, my initial thought when reading that was, so the clinical solution for a couple struggling with intimacy is to explicitly agree not to have sex. Like, it just sounds like giving up.
It only sounds like giving up if you view penetration as the only valid finish line.
Fair point.
Think about the mechanics of the pain fear loop we just talked about. The brain is terrified of the friction and the pain of penetration. If you remove the possibility of penetration entirely from the evening, you remove the final exam.
Oh, wow. I see. If there's no final exam, there can be no performance anxiety about passing it.
Exactly. The couple agrees to engage in physical touch, massage, or self-exploration, but with a rigid, agreed-upon boundary that it will not progress further.
So brain knows it's safe.
Right. Because the brain knows with 100% certainty that the painful event is not going to happen. The collision avoidance system doesn't need to engage. The SNS stays dormant.
And when the SNS stays dormant,
The parasympathetic nervous system is finally free to take over.
and that's when things start working again.
This is often when patients report a sudden, surprising return of their body's natural lubrication. Without the intense pressure of the impending pain, the VIP and nitric oxide start flowing again.
The hydraulic process just boots back up.
Because the cognitive blockade has been lifted, the body remembers how to execute the process.
So you are basically sneaking past the brain security system. You prove to the nervous system over multiple encounters without that pressure that intimacy does not equal pain.
You rebuild the association with safety. It takes patience, obviously, but the neurobiology supports it entirely. You are literally writing over the old corrupted data with new, safe data.
This completely changes how I view the mind-body connection. I mean, let's synthesize all of this for the listener.
Right.
If there is one core insight to pull from this massive stack of research today, it is that sexual dysfunction rooted in anxiety or a history of pain is not a permanent state of brokenness.
Not at all.
The lack of physical response is actually evidence of a highly robust, perfectly functioning survival system. Your body is doing its job. It just needs to be gently, consistently shown that the war is over and it is safe to power down the defenses.
Beautifully said. Which actually brings up a final concept that isn't explicitly detailed in the clinical guidelines, but it flows so naturally from the science we've discussed today.
Oh,
What's that? Well, we spent this entire time talking about how the brain accidentally conditions itself to trigger a stress response in the bedroom, right?
Mm.
It learns to associate intimacy with the sympathetic nervous system.
Right, the hot wiring of the threat response.
So what if you could reverse engineer that classical conditioning?
What do you mean, like Pavlov's dogs?
Exactly like Pavlov. He trained dogs to associate a bell with food. Could a person intentionally train their own nervous system to associate a highly specific physical trigger with profound parasympathetic relaxation?
Like hacking your own biology on purpose.
Imagine taking 5 minutes every single day in a moment where you feel completely safe, warm, and undisturbed,
Okay.
and you practice deep, slow diaphragmatic breathing while inhaling a very specific, unique scent, perhaps, like a rare essential oil you only use for this exact purpose.
So you are deliberately linking that specific olfactory input, the scent, and that deep breathing pattern directly to your body's rest and digest state.
Right. And over weeks or months, you forge a really strong neural pathway. That scent equals absolute safety.
Okay, I see where you're going with this.
The question is, could you then deploy that conditioned trigger right before intimacy?
Yeah.
When the performance anxiety starts to creep in and the spectator role threatens to flip the SNS switch, you introduce the scent and the breathing.
Oh.
Could that deeply ingrained safety trigger manually override the anxiety, forcing the PNS to stay online?
Just using your body's own predictive machinery to write a manual override command for safety.
Exactly.
The fact that our biology is malleable enough to even entertain that idea is just incredible. The nervous system isn't just this rigid set of rules, it's a completely adaptable landscape.
It just requires the right inputs.
And the patience to provide them. Well, this has been a phenomenal look at a biological reality that so many people face, yet so few understand. For everyone listening, remember, the machine isn't broken. Sometimes you just have to help it find the right switch.